pioneering partnership is taking a preventative approach to supporting the mental health of young people involved in or at risk of becoming drawn into crime and violence in Staffordshire. The Violence Reduction Team Wellness Project sees MPFT's Lauren Cockroft working closely with Staffordshire Police to identify vulnerable individuals and intervene in helping them access the right help when it's needed. The project, funded by the Staffordshire and Stoke-on-Trent Violence Reduction Alliance, is already seeing real success in addressing the root causes of violence and crime among the young people it supports, and is helping to turn dozens of lives around. We're really pleased to be joined by Lauren for this edition of the MPFT Podcast, where we discuss the impact the partnership is having. We hope you enjoy the episode. Lauren, thanks for joining us today. Really appreciate your time.
Thank you.
Thank you. So, can we kick off with a question about you, about kind of what brought you into the NHS and more specifically mental health? I know you work as a mental health practitioner and a clinical associate in psychology. So kind of what brought you into working for MPFT and then sort of by extension for the health and justice services that the Trust provides?
Yeah, so I've worked in mental health for about 15 years now. Initially in the third sector with charity organisations, and then had my first NHS job in 2019, and that was with MPFT, but doing something completely different. So I didn't join Health and Justice Services until I started this job about 2 years ago now, and the sort of career that I've had so far, the running theme in that has been sort of working with people who are disadvantaged or don't sort of have that readiness or ease of access to traditional mental health services. So learned quite a lot quite quickly, really, and I've kind of meandered through my career doing various things. So when I saw this job advertised, knowing that it was a pilot project, we were starting just from a skeleton idea, but the scope of the work and the demographic that we'd be working with, it really appealed to me, and I almost didn't apply for the job, but I'm very, very glad that I did. I had two friends that I was working alongside in adult services in Stoke-on-Trent, wonderful colleagues and friends, and they gave me the pep talk that I needed really to apply, and it's been wonderful since then. So yeah, I feel really supported within health and justice, and I'm really proud of what we've done, so it's great to be able to come in today and talk about that.
It's an interesting trajectory because I appreciate mental health and certainly health and justice services are a trajectory that not everybody goes down. And the project you refer to, of course, the Violence Reduction Team Wellness Project. So that's funded by the Violence Reduction Alliance in Staffordshire, and it's working with Staffordshire Police. So am I right in saying that it's Staffordshire Police that did they kind of go looking for the role that you then applied for?
Yeah, they did. Yeah, so the Violence Reduction Team, from a policing point of view, has been well established for a number of years. It was previously known as the sort of gangs team, and then culture moves forward, our understanding of circumstance for young people moves forward. So they are now called the Violence Reduction Team, and very quickly they identified that the young people that they were working with, they don't have easy access to mental health services, but most of the children that they'd be working with and the young people that they'd be working with experience some level of distress, and sometimes that would be because of past experiences, some of that would be because of their sort of current context in life, but due to risk and sort of existing pathways in traditional services, those young people would just kind of fall through the nets, really. There was nothing in place to sort of offer a safety net and a service that was bespoke to them. So they approached commissioners with the idea that we need this essential part of Violence Reduction Team. So it went through commissioning. MPFT did a great pitch, but none of us kind of knew what we wanted that to look like. Yeah. It just started off as an idea that we need something for these young people, and it's just kind of rolled from there, really. So when I was put in post, there was myself, a Band 4 practitioner, and then above us was just operational managers, really, who were fantastic. But we were starting from scratch with just an idea. So very early on, to me, having worked on previous pilot projects before, so I'd previously worked for MPFT on the family safeguarding project in Telford, integrating mental health services into the safeguarding structure that they've got there for children and families. So there was a lot of experience that I brought from that into how I approached working with the policing team, and that partnership working really has really allowed it to flourish and build what it is today. As I say, we're just starting from an idea more than sort of specific pathways or outlines or treatments. The evidence base is there as to what treatments are indicated and how it's best to engage young people who are experiencing some of the things that our young people do. So that was there, and it was building from the ground up, really. Okay, how do we want to do that? Because the traditional ways of doing that obviously exist aren't working for this group of young people. So yeah, from very early on, the first thing I did was just working on the relationship with the team, hearing from the police officers what they experience in terms of the young people's sort of context, the access to services, what has worked, what hasn't worked, what they experience in terms of presentation as well. Is it that they're seeing a lot of unwell children, or are they seeing a lot of children who are, quite understandably experiencing high levels of distress, stress, trauma, things that don't fit quite nicely and neatly into sort of traditional pathways with CAMS or community mental health teams, for example, and what are the risks alongside that as well, because we've got duty to respond to those as well and keep young people safe while we're sort of working on treatment pathways and things as well. So yeah, that's how it started, really, from just a sort of an idea from what the officers picked up through to where we are now. It's been a bit of a whirlwind, really.
I mean, I appreciate that wouldn't fit everybody's kind of mould for what they want to do, and that could be quite daunting to a lot of people. Also quite exciting because you can mould it to what you want, and there's obviously a need identified. Otherwise the project wouldn't exist, but it's kind of being able to then do what you want to do with it. And it's also, I think, it's worth mentioning about it's interesting about the preventative aspect of that, because I appreciate within the NHS we often talk about sickness, we treat sickness, and so somebody with a mental health issue will treat and support them, but the prevention aspect, I certainly through the things like the NHS 10-year plan. But then this fits very nicely into that as well, about the preventative aspect of it and the public health element of that as well. Is that kind of partly what attracted you to the role, about sort of trying to get to support children and young people before things kind of escalate or deteriorate?
Absolutely, and that's kind of what I picked up through my career, working in various different sort of areas, is that there's things that happen, things that we experience, and it's a roll of the dice whether these are things that come and be part of your life, and there's certain vulnerability factors. And what I noticed through the other jobs that I've done is those opportunities for early intervention and prevention before someone gets very, very unwell, and the impact on their life becomes so far-reaching, it almost bleeds into every part of life for some people. And I remember working with people in their 50s and 60s who have had the same experiences as the children who I work with at VRT, who, some of them are 9-10 years old, and what's always in my mind is the opportunity that we've got while they're young, while they're still learning, while they're still forming their narratives about their experiences and their life and who they are, what that means to them, what they've experienced. You see the trajectory. And for me, the really exciting part and the thing that I'm most passionate about is not pathologising some of the experiences. Obviously, if someone is unwell, then I work with sort of the extended partnerships around us and community mental health teams and, the existing structures that are there to ensure that they got access to treatment for an illness. However, most of the young people that we see at VRT, they're not unwell, they're having a very understandable response to, very unusual circumstances through their life.
We all would,
and the there's some lovely cases that I've worked actually where that early intervention, you see that pay off tenfold. You know, we've been able to work with people who before they've got unwell, to help them to understand their distress. The evidence base is in psychoeducation, it's in emotional literacy, it's in connection and sort of relational safety. And a lot of the people that I meet through this job, they haven't got any of that, you know, that through whatever circumstances they find themselves in a life that they've inherited where they've got none of those skills.
Well, they've slipped through the cracks.
Yeah, that's it. You know, the usual interventions through school, through third sector organisations such as Changes or community mental health teams and CAMS. You know, if those services were right for that young person, they would have done their job by now, and that person would have had all those skills that we would hope that they'd pick up along the way. But some children just don't have those opportunities for whatever reason. It could be any number of things that leads to that. But having the opportunity to offer those skills, that time, that energy, and you know, there's a really poignant piece of research that speaks about the role of one trusted person in a young person's life while they're experiencing something stressful can make or break how they recover from
absolutely.
that. You know,
at the right time.
Yeah, absolutely. And you know, you find wonderful quotes from people a lot more experienced than me who talk about the event isn't the trauma, it's the response to the event that becomes the trauma. You know, it's the wound that's left that becomes the trauma. So using sort of the skills and experience that I've picked up throughout my career and the wonderful training as a clinical associate in psychology really allows me to be creative and integrative in terms of how I meet a young person where they're at really and see their skills, their resiliences, their strengths, and build upon that, because a lot of the time, you know, the services have been around a young person for a long time by the time that they sort of land with the VRT. And certainly by the time they meet me, they've gone through a whole journey with the police officers as well.
I guess once you bounce around from one thing to the other, you then build a natural cynicism towards a lot of this, because you think you're just going to be, when they see you, they're going to be bounced to you, and then you'll spend a bit of time with them, then they'll go somewhere else. And you mentioned about time earlier on, so how important is that to be able to spend that time, which I appreciate for certain young people with real complexity in terms of the issues they present with. You need to spend that time to be able to support them, and how important is that?
It's absolutely vital, and traditional services don't have that. You know, the caseloads are so high and the workflows are so high, and you know, moving people through their sort of pathway, it's really time bound. But as you say, a lot of the young people that I'll meet, their level of trust in services, let alone other people and adults, you know, it doesn't exist. There's something called epistemic trust, and that talks about where we lose faith in the systems around us that we believed were there to help us, and you know, that relational element of being able to lean into a relationship, trust someone, be vulnerable with somebody. A lot of the young people that I'll meet, they don't have that at all. They've never experienced that. They don't know what that feels like, and it can be quite scary for them. So there's a huge time investment between myself and the VRT officers, and it's sort of grown larger than just us actually in VRT. You know, we work so well with the multidisciplinary teams around a young person, because actually if there's a relationship that is key to that young person that we can capitalise on and share those skills and that knowledge and that experience through that trusted person, we will do that. So from the outset, really, some of the most key partnership working, I would say, is the collaborative formulation that all children that are, all young people, that are referred to me for intervention will have a multidisciplinary collaborative formulation.
So when you say collaborative formulation, is that kind of what you're just referring to there about the integration of sort of how they kind of work with different teams and services? Yeah,
absolutely. So formulation, it's the process of developing a shared understanding, and actually what we found is that we've got a lot of shared values, we've got a lot of shared goals across multidisciplinary teams, but bringing that together through a trauma-informed and child-focused lens doesn't always happen for whatever reason. And again, you know, there's organisational stuff, there's cultural stuff that sort of gets in the way of that sometimes. You know, if you're working with an organisation who is very sort of results driven, and there's a sort of heavy focus on process within that, you've got to invest in that time to align our viewpoints and ways of working around a child. And the collaborative formulation that we do allows for that, and people have really embraced that, which is wonderful.
That's
and
great.
you see it pay off so well. So there's young people that will feel the benefit of the service that I will actually never meet. We're able to use the existing teams around them to have the biggest impact. So it could be, for example, a young person has come into contact with VRT because there's a risk of violence, there's recurring incidents, there's police call-outs, there's ambulance call-outs. And actually, when we're able to do that collaborative formulation, it comes to light, this is an unmet SEN need, or this is this child expressing a discomfort or distress around something that's going on. So what can we do about this? Because actually the hour a fortnight that I can offer them probably isn't as impactful as the everyday things that the people already around them can do. So we will work with parents or care staff and direct them to training, find resources and share them, do skill sharing sessions, do sort of reflective practice type conversations as well, and really kind of hot house around the MDT and how they do their best around a young person with that psychological and trauma informed insight, really, which is wonderful to then hear the success stories of, oh my gosh, this child's presentation has completely changed because we've understood this part of their needs and we've responded in a way that's a little bit different or a little bit creative, or actually instead of asking this person to sit down and concentrate on an hour-long sort of emotional literacy session, we've just made that part of our everyday interactions, and we see that paying off, and oh my gosh, suddenly they're talking to me about their feelings rather than me simply asking them about what I'm observing in them. So it's really fantastic that we can sort of utilise the partnership working in that way.
Yeah, I mean, I was going to say that when you, as you were just saying that, the image of, it's a bit of a cliched image, but it nevertheless is cliche for a reason, of like the jigsaw puzzle where the piece that you provide, the piece that all those pieces kind of fit together. So you mentioned about the hour that you spend every fortnight with an individual, being able to achieve so much, but it's that alongside this or that or this or this, all together kind of helps that individual in different ways, maybe without them realising it. And I mean, yes, absolutely. I think that piece that you offer is, to me, strikes me as enormously important, because it's certainly offering something which that child, young person may never have had those conversations before in that way.
Yeah, absolutely. And it's a privilege to be able to be the practitioner who can take the time, who can facilitate that shared thinking and shared problem solving, rather than sort of just being dragged along by the flow of, you know, work never ends, does it? You know, if we've got a job to do, it just kind of rolls on really easily. But in this role, I've got a real privilege to be able to sit back and keep a focus on that psychological lens and you know, be an advocate for that young person within that, and utilise the evidence base that we've got, which, as I say, you know, it's huge. You know, we know that young people experience difficulties, and we've got a lot of research that tells us sort of the ways through that. And actually, not every practitioner around a person is going to have that knowledge or that experience or feel confident with those skills. I would say most of the practitioners that I work alongside, they've got fantastic skills, but their level of confidence doesn't match up with what they're actually capable of. So sometimes that shared sort of learning that we do, you see practitioners go away feeling a lot more confident, feeling a lot more able, feeling a lot more sort of capable when they're holding that psychological space and having those curious conversations. And sometimes that's in preparation for a young person then meeting me, so they kind of do the legwork, and we see that pay off, you know, that preparation time and honing in on motivation. And it's almost like the stars have got to align for a mental health intervention to be successful, really, like any change. You know, there's got to be so many factors that are right around somebody for them to take that leap of faith and try something new. So what we can do is through that partnership working is really make the most of that lead up, and then we can strike while the iron's hot with building some relational safety with myself, with introducing some interventions, with getting them going, with actually putting into practice some of the stuff that we will talk and think a lot about, but actually the change happens in the doing, in the difference of decision making, in the difference of how we respond to what we notice in ourselves, and even, you know, building in the opportunity for us to sit back and notice what's going on internally. So a lot of the young people that I will meet, they've been so squeezed in terms of their capacity to just notice what is going on, and sometimes that's circumstantial, and sometimes that's because they've never been taught that they're allowed to do that. So yeah, to bring all those elements together, I would say it's definitely the hands-off work that I do that leads to the really successful one-to-one work that I do when I eventually meet a young person, and referrals reflect that really. So we've got around 150 referrals that I've offered some kind of consultation or advice on, and we're sitting at around 40 where I've actually met the young person and undertaken some level of work with them. So really low case load numbers for the first 18 months, but that to me says that we're doing things right, because we want to be protective of the time for the young people who need it, and we don't want to be duplicating work that actually is done really well within MDTs already. So for me it's a huge success so far, and rings true to everything that I've said about that partnership working really, and how that pays off tenfold really in terms of the investment that we make in time and energy towards that, which feels like a big ask for a lot of organisations and partners who they are so busy, you know, safeguarding social workers or child exploitation social workers, they make the time to come and spend that collaborative time with us as police officers and psychologists, and they speak so highly of that experience and how that helps them, and how they see that then transfer into how they approach that young person, advocate for them, and bring them into sort of that specialist service that's there waiting for them really.
And could you talk about I'm talking about partnerships there, and I guess one of the most important being the police. Do you mind talking a little bit about that side of things, how you work with them, how that work's evolved over the last 18 months as well? Because I'm sure it has over that time. You've kind of learnt together. Yeah.
So when I first started in this role, I was under no illusion that we trained and we work in very different ways traditionally. You know, my training, my experience in my career is very different to someone who's worked for the police force for 25, 30 years. You know, we've got some really wonderfully experienced police officers on the violence reduction team. So I approached it in, I want to learn from you, and I'll invite you into that middle space to learn from me as well. So I was a little bit nervous going into it initially, but I had no reason to be. You know, the team was so welcoming, they've embraced me, and what we've tried to do as a project so wonderfully. And initially we did kind of tiptoe into the development of the pathways, trying to be responsive to what the officers were identifying and build that together. And we kind of looked across other health and justice services that work in partnership with the police as well, and we thought, okay, we can see what's working across them services as well. Do we want to bring aspects of that in, or do we want to be really creative and sort of build something brand new really in terms of how we navigate this together? And the support that I've had with, you know, my thoughts on how this developed was certainly based in the evidence base and the research that we've got, and that was really easy to do alongside a team who, you know, continually invest their time and energy into that. They offer feedback as we go. They sing the praises and interact with me, and it's gone from a point of I'm having to sort of handhold them through safe formulation or making a referral, ensuring that referral's got really quality information on it, through to the first time I hear about a child or a young person, they will have all that information ready for me now. So they've really embraced it, and you see it pay off as well. You know, one piece of feedback I had was one of the officers shared about an experience that they'd had outside of work, and he said to me, I would have never viewed it that way if I hadn't met you. And he doesn't mean me, he means, you know, someone with the knowledge and experience and sort of forthcoming about sharing that different sort of viewpoint on things. You know, I don't see that I do anything special clinically. I could be anyone, but what is really great is the opportunity that we've got to sort of be in there and embed not just that work in practice, but that shift in culture that doesn't just stop at work. You see it sort of transfer out into personal life as well, which is wonderful. Yeah, and you do, you know, there's been cases that we've worked collaboratively on as well, where I'll contract with the young person, okay, which bits of this are you happy for me to share with your field officer? Right. And we'll agree that, and they'll say, oh, but tell them about that because that was really helpful. So then when that police officer's involved in a crisis situation with that young person, they're primed and prepped with the coping strategy that is most useful for that person, or they're ready to say to that young person, come on, this is really important, I've spotted this in you, let's take this back to Lauren together. So that sort of that flow between us, we maintain our professional boundaries and confidentiality obviously, but we work with that young person who's very aware that we're all working together on which parts are really helpful for us all to know, and you do see that pay off, you know, crisis situations that come down so easily because the officer's now feeling really confident in holding that space of distress with that young person. And one of the wonderful aspects of the partnership as well is seeing the confidence of my colleagues and you know, I would go so far to say friends now. You know, we've developed a really wonderful working relationship across the team, and they are so forthcoming in seeking advice and guidance and working on those skills. It's just wonderful. I couldn't have asked for a better team, and now to have the opportunity to share that with the VRT South team as well as the project grows is really wonderful. So we've secured some additional funding from the Violence Reduction Alliance, which started in March, which allows us to move further south in the county and hopefully employ another Band 6 member of staff as well who can work alongside me and hopefully sort of spread the success to children who need it in the south of the county.
Fantastic. And you mentioned about success when I mentioned the intro about how he's helped dozens of lives. So I suppose as well, what I mean by that is as well as the individuals themselves, it's the loved ones, the families, that kind of that ripple effect that this has, no doubt. Do you mind just give us an example of somebody who comes to mind who you've supported where that's really sticks in your head?
Absolutely, yeah, and there's a lot really. A lot of the young people that I work with, especially as some of them are a lot younger, you do work well with the family as well, and there's been situations where I've done one-to-one work with a young person and also worked with the family alongside that as well, and sometimes we're able to even facilitate that young person inviting their family into, you know, maybe a piece of work that we've been doing together that they think, I really want my mum to know about this, or I really want my carer to know about this. So we will structure sessions around, okay, how do we bring them into that conversation? How do we make sure that you feel safe and that you can trust everyone in that situation? What specifically do you like to share with them? How are you expecting their responses? And do a bit of sort of experimentation as well around their perceptions of the people around them. So as I say, you know, trust is so lacking in some of the young people that they even believe that if they would share that with the person who loves them the most in the world, they would be rejected or punished for that. So we do a lot of that sort of tiptoeing into involving families as well, where it's wanted or needed by a young person, and there's a systemic kind of lens across families when I'm working as well. You know, if I spot something that actually would be really helpful for the family support worker to pick up with family members, but the young person's not at a point where they're willing to sort of take part in that at that point, I'll do some work with a family support worker, or I will go and do some work with permission with a parent or carer as well, and try and stay away from sort of formal family therapy. It's not something that's within my remit to do. We simply don't have the capacity for that within the team at the moment. But the kind of feedback that we get is about how drastically different they experience living with each other. Really, they talk to me about even just existing together in the same household. It changes. You see moods lifted, you see interactions become less sort of fraught with tension and sort of defensiveness, and more collaboration within family units. There's a young person that I worked with who even their grandmother gave some lovely feedback on, she felt very protective of her grandchild, and she had lost a lot of faith in mental health systems and the wider systems around young people as well, after years and years of kind of not seeing any impact for their grandchild, and she gave some feedback about how we've worked together and the difference that she's seen not only in a grandchild but in all other grandchildren that they live with, and how they interact, and their sense of confidence and their understanding, their ability to sort of self-advocate and express themselves in such a different way, and that she couldn't really believe the difference that she'd seen in such a short period, really. And the key factor in cases like that is that time investment and that relational safety, and meeting that child where they're at rather than trying to squeeze them into a pathway. Actually, let's work integratively and create that pathway that is right for that child at that time, which, as we said before, not everyone's got the opportunity to do, but in this role we really can.
Fantastic that the project is looking to expand, the work you do is, I think it's one of those things that you will only really understand the true impact as you generation to generation, I think. And so but thank you very much for your time. It's been really fascinating talking to you, and I know how busy you are, so thanks for your time. I really appreciate it. And it's a great example of partnership working. I think really gets to the core about how services can work together better for the impact and improvement it can make to people's lives. It's fascinating. Yeah,
that's it, and that's what sits with me really. And we have conversations about the ripple effects, and a lot of the ripples we will never see. And one of the pieces of feedback that we had from a young person after he had his own child, actually, he said, you've not just changed my life, you've changed my child's life as well. And how do you quantify that? The sense of pride that I had, not only in him but in what we've been able to accomplish as a team around him, to support him, to hold that view of how things might be different in his life moving forwards. You can't really keep track of that, can you? But it makes me feel so proud.
Absolutely, as it should be. But thank you very much for your time.
Thank you.
Thank you and for joining us today.
Thank you.
Thank you very much, Lauren, for joining us, and thank you for listening. Don't forget to check out our YouTube channel, where you'll find other episodes like this one. You can also listen to the show through your podcast provider of choice, and we'll include links in our show notes on how to do so. Bye for now.